Hi, it's Michelle again. I wanted to make a part 2 video to the wrist exercise video that I started about how to help your wrist if it's stiff after having a wrist fracture or a wrist injury. So part 1 was just more active range of motion, and that's really what you want to start with when you are trying to get that wrist moving, because that's usually once you get through the active motion and it feels good, then you can start with a little more aggressive stretching, such as passive motion, or a little bit of strengthening. And this all depends on your physician, who's probably guided you with what you can and cannot do. So part 2 is to start on passive motion. So if you watched part 1, you were just doing active motion. So you were just doing active extension and flexion. Now, if you notice you can't get back to that extension, so say this is like all you have for wrist extension, you can start doing what's called prayer stretch. So that's where you take both hands together and keep your palms together, fingers together, nice and straight. And what you want to do is you want to bring your elbows up as you sink your wrist down. You can do this on a table as well, and that might give you a good idea as far as how far down that you're getting, and that's a good way to gauge how much more you have to go. Now, sometimes you might only start right here and this is it. That's all you can do, and that's okay. That's the starting point. This is number 1. So fingers together, palms together. Oftentimes people want to do it like this. And look at how much I'm bending my fingers. That's not good on those joints to put too much pressure on our knuckles. So palms together, fingers straight. Slide down as far as you could go. And if it's only to here, that's okay. And then you want to hold that for at least a count of 15 to 20 seconds. So you should be able to get a few good breaths in here. And you want to make sure you're not holding your breath while you're stretching, because that makes us tighten up. And we're not pushing our hands together. We're just simply allowing them to touch softly and sliding down. And taking a few breaths. And then coming back up to rest it. Rest about 15 to 20 seconds if you need to. And come back down. Stretching, keeping it up straight. Notice my fingers are straight, not pushed to one side. Sometimes when you're tight, like say my right wrist is very tight, you might see this happening if you try to push too far. We want to get that nice and straight, nice and even. You may not be able to go down as far, but you're stretching that wrist properly and you're not going to injure it. Holding a few good breaths. Holding here, not holding your breath, but holding this position and breathing for about 2 to 3 good breaths. And relaxing. And you want to do that a few times. I would start with at least doing 5 of these if you can, and progress up to about 10 of them a couple times a day. Like 3 times a day or so, 5 to 10 repetitions, until you've got good motion and you're going all the way down, or at least as far down as where you think you were prior to your injury. Now, the next one you want to do is wrist flexion stretch. So if you're going from here, it may not be very comfortable going all the way to wrist in the flexion in the opposite direction. So if you need to kind of loosen it up a little bit before, or wait a minute or 2 before going into flexion, then I would recommend doing so. So what you want to do for wrist flexion is you're going to move the wrist down as far as you can go. So if that's all you can do, you're going to take your other hand and you're going to come on top of the hand, not the fingers, but on top of the hand, and you're going to push down as far as you can go. Now this one again is good to do on like a tabletop where your elbow is kind of down and you're not doing this. Because then I'm not moving my wrist much at all. Or people want to do this. And again, they're just moving more their shoulder and they're not truly moving their wrist. So elbows nice and straight. Wrist goes forward as far as you can. Other hand comes on top of the hand, not the fingers. And gently pushes down to where you feel a nice stretch. Just to a little discomfort, not pain, no sharp pain. And again, holding that for a good 10 to 15 seconds. So taking a few good breaths. And then relaxing back and resting that for a few breaths or a few minutes if you want to. So again, coming forward, hand on top, and pushing down. Now you may not be able to go as far as I can go. I've never had a wrist injury on this hand, so I can go pretty far, but not everybody has that ability. So you only go as far as you can go, or as far as you think you had prior to your injury. Good. So you can do those two to help get wrist extension and wrist flexion back. And then same thing for doing ulnar deviation and radial deviation. So you can push, same thing as far as pushing. So you can do just some gentle pushing into the hand again to try to push to the side here. Or you can take the whole hand even and kind of get a nice grip on the hand, and then you can just do a nice gentle grip and push over to the side that you're looking to stretch. So if you need to stretch in ulnar deviation, you would use your hand to stretch in ulnar deviation. Now if you're stiff going in radial deviation, again you would take your wrist, your hand, and you would try to stretch it going in radial deviation. You can do that in this way if it's more comfortable towards you and with your hand in this position, this way or this way, whichever is more comfortable for you. And again, holding those positions for about 15-20 seconds, but doing these a couple times a day. That's where you'll get the most benefit, is if you do it more often and not let that stiffness set back in. Now the last one you're going to do as far as passive stretching is if you're stiff in the forearm. So in video 1 we did up and down. We did part 1, we did supination and pronation. So to get supination, you would take your other hand again and come up underneath and you could do this two ways. You can use your thumb to help push your hand over that way, and your fingers are underneath kind of doing a little bit of a counter pressure. Or you could do it this way where you come up and you're using your fingers on top to push forward and your thumb is underneath doing a little counter pressure. So again, holding that for a good 10 to 15 seconds, relaxing the shoulder, not letting the shoulder get up here, or noticing any kind of movement in the elbow. So the elbow should be nice and tucked at your side, and you're simply coming up with the forearm in neutral and then gently rotating it over. Now you don't want to torque the wrist here. So notice I'm not going with the hand here and torquing the wrist, because we have lots of mobility that way. And we don't want to hurt the delicate structures in our wrist, the cartilage or ligaments in our wrist. So come down a little bit below the wrist crease on the forearm where we can get nice feel of the two bones and rotate them over. So holding 10 to 15 seconds and doing again 5 to 10 of those. Then lastly, we want to do pronation. So that's where we take our hand and just go in the opposite direction. So you could use your fingers and thumb again to just rotate and push down, or coming around and using the thumb and the fingers underneath and the thumb on top to rotate and push down, kind of like that. And stretching down as far as you can go. Holding 10 to 15 seconds, or 15 to 20. Breathing, just making sure you're not holding your breath. And then relaxing it. And give yourself time between each of those stretches if it seems to hurt with transitioning from one stretch to the other. Hope those help with getting increased mobility and less pain in your wrist. And stay tuned for video 3 for the wrist, because we're going to go over a few other exercises you can do and some strengthening for your wrist. See you next time.